Hello, I'm Leslie Smart, President of CHI St. Joseph Health Foundations, and on behalf of our leadership, physicians, and employees, welcome and thank you for supporting Evening of Hope. For the second year, the 5 CHI St. Joseph Health Foundations are raising funds for a very important cause: to support cancer care resources in your community. With our locations in Bardstown, Mount Sterling, Lexington, Berea, London, and Corbin, we are providing award-winning care on a daily basis and offering one of the most important tools in our patients' journey with cancer: hope. Mother Teresa once said, "Hope sees the invisible, feels the intangible, and achieves the impossible." In just a moment, you will hear an incredible grateful patient story and the importance of philanthropy that directly impacts the quality of care we are able to provide. But first, I'd like to extend our gratitude to our generous event sponsors who made this event possible. Your generosity has been so impactful. I would also like to thank our hosts who have created a special experience for you. They care deeply about this mission, and we are grateful for their hard work over the past months to make Evening of Hope a success. I'd like to invite you to browse our incredible silent auction items, which you will find through the Greater Giving link on your phone. Generous businesses and individuals from across our state and beyond have donated one-of-a-kind packages. The auction will close at 9 p.m. on June the 18th. You will also have the opportunity to provide an outright gift of support. Your host will provide more details following the video presentation. And now let's learn more about the amazing care provided to a very grateful patient and her family.
My name is Kelly Terry. I'm from Richmond, Kentucky. I'm married. I have 3 children. I had colon cancer. I was diagnosed in 2015. There are no words to describe someone telling you that you have stage 4 cancer. You're in disbelief, you're angry, you're sad, and you're scared. When I received the diagnosis, Dr. Pierce told me that there were treatment options. Usually stage 4 is uncurable, and we could treat the cancer and keep it from spreading.
When she came to me, she had no idea of how serious this problem was. She had already been through a very serious surgery, but unfortunately, after she met me, we did a study to show that she had very widespread disease, something that she really didn't count on. So it was a very trying situation, because by the time I met her, her youngest children might have been only 5 and 8 years old at the time. And I thought, well, we're going to have children without a mother here quickly. But it's been near miraculous.
I received my treatment at St. Joseph Cancer Center. It was 77 chemotherapy treatments over a period of 2 years.
So at first, I think people are overwhelmed, depressed, tearful. It is an overwhelming situation. But as humans, we also pick ourselves up off the ground, and we kind of dust ourselves off, and our human nature is to fight, and to fight aggressively. And I believe she went through that process.
Stephanie made a big difference. She made me feel like I was at home, and I was so comfortable getting my treatments. It didn't feel like I was in a clinic or, a medical setting. I felt like I was at home. Just exceptional care. And Dr. Pierce, I can't say enough about him. You can have all of the most advanced equipment in the world, but if you don't have the knowledge and experience behind that equipment, it's useless. The day that I received the news that I was cancer-free, I was sitting in my room, in the patient room, and Dr. Pierce came in with the scan, and the first thing he said was, "You are in remission." And I was so happy. It was like the best day of my life. I stood up and gave him a big hug, and I thanked him for everything he did for me. And as we left the room, when we stepped out of the room, all the employees had lined the hallway, and they applauded me as I walked down the hallway, and there wasn't a dry eye in the clinic.
And I've been able to repeat it several times. As far as she's had scan after scan, it's been normal. It's been tremendous. The patients are extraordinary, as far, especially when people have positive outcomes. There's nothing better than that, as far as seeing, how you impact people in their lives, and it's overwhelmingly, wonderful. We have an excellent team of people that I work with, as far as the nursing staff, the ancillary staff, and all that. Many of us have worked together for many years, and we're a pretty tight group of people, and we always try to keep, the patient first. In fact, we repeat that each day to each other, as far as who's first. Well, the patient's first. Cancer affects people on many levels. There's the emotional part, as far as being overwhelmed with the serious news of having a new diagnosis of cancer. But there's different levels of it too. There is the financial part of it. Cancer care is extremely expensive. And we have a patient population that many people are impoverished. They live at low economic levels. And so even simple things like providing transportation or money for gasoline or other things like that, a place to stay in town to get radiation, these are all things that are really necessary. And if you think that everybody's treated the same in this world, they're not. And we want our cancer care to be the same for no matter who it is that we're providing it for. So it helps even the playing field, so to speak, and allow us to not compromise people's care in any way. You want to use the best and most modern equipment so that you can offer your patients the best outcome. And so, getting money donated to our cancer center helps provide that for them. We offer services to people that are really in dire need, and so that's a very important responsibility. When people have nowhere else to turn, we're here for them. It's nice to have the Cleveland Clinic Cancer Center available for us, and we use them as physicians on multiple levels as far as for consultative purposes. And so it offers our patients who live here locally to have expertise from 6 hours away readily available to us at a moment's notice. And so it helps these people stay here in our community, yet get that expertise from the Cleveland Clinic Cancer Center.
My experience at the St. Joseph Cancer Center was truly amazing. The care I received is second to none.
She's an exceptional person. Yeah, she's tremendous. It's nice to hear. It makes it worthwhile that you do the job you do.
Thank you for joining our Evening of Hope dinner tonight. As you enjoy fellowship and good food with friends, it's important to remember the purpose of this special event. As you know, cancer affects all of our communities across the Commonwealth. Just this year alone, Kentucky is estimated to diagnose more than 30,000 new cases and lose more than 10,000 neighbors and loved ones to cancer, which is the highest rate of cancer deaths in the entire country. At CHI St. Joseph Health, we are pioneering next-level cancer care to combat this disease. For more than 40 years, our ministry has led the way in cancer treatment and diagnosis throughout central and eastern Kentucky, and we support more than 73,000 patient visits every year. As we continue to deliver highly specialized care, expertise, and convenience, we've expanded our access to second opinions and breakthrough treatments through our affiliation with the Cleveland Clinic Cancer Center, ranked as one of the nation's top programs. We are fighting and innovating to deliver the best outcomes for Kentuckians. But we need your help. You have the opportunity to make a real difference to help fight cancer and find hope. Join us and invest in our mission to save lives. In the spirit of our founders, the Sisters of Charity of Nazareth, these critical dollars will allow us to continue to help every person, regardless of their ability to pay for their care. Thank you for your generosity, your prayers, and your ongoing support for the team and patients at CHI St. Joseph Health.